Good morning, everyone. I'm Frédéric Chabot from Action Canada for Sexual Health and Rights. This is Canada's Planned Parenthood Federation, and we are a member of the Future Planning Initiative. Today, we are here to launch Just the Numbers, a new analysis by the Guttmacher Institute with Canadian data that makes one thing unmistakably clear. Canada's leadership on sexual and reproductive health and rights is working, and it matters more now than ever. We are living through a pivotal political moment. Around the world, and most visibly in the United States, we are seeing a deliberate effort to weaken global health, human rights, and the systems states rely on to work together. That effort is being driven by a convergence of actors, authoritarian governments, far-right political movements, and well-resourced anti-rights network operating across borders. Some countries have worked explicitly to undermine multilateral institutions and reframe the rollback of rights as a legitimate exercise of state power. In parallel, far-right movements in democratic countries have targeted sexual and reproductive health and rights because they are an effective way to mobilize fear, reassert social control, and open the door to political interference in people's lives. These actors are not motivated by fiscal responsibility or evidence of what works. They are motivated by power. Control over bodies, especially women's bodies and the bodies of queer and trans people, has become a strategic entry point for broader attacks on equality, pluralism, and democratic norms. Sexual and reproductive health and rights are not incidental in this moment. They are targeted precisely because they sit at the intersection of autonomy, gender equality, science, and the role of the state. Undermining them helps dismantle the broader systems that protects our human rights, keep our world safer, more stable, and sustains global cooperation. This is the global context in which Canada is making choices today. So the question is simple. Who do we want Canada to be in the world? For more than a decade, Canada has answered that question with leadership. Through its 10-year commitment to global health and rights, Canada made a clear promise to be a predictable, principled partner, investing steadily in evidence-based solutions that save lives and strengthen health systems around the globe. The data released today shows exactly what that leadership has delivered, and those outcomes are not abstract. They are felt by young women who can finish their education, by families who can decide when and if and how to have children, by children who don't lose their mothers during childbirth, and by health workers who can provide care without navigating constant crisis. They are the result of deliberate policy choices, stable, multi-year investments grounded in evidence and respect for people's rights. At a time when economic anxiety is the emotional baseline for a lot of voters in Canada, it is essential to say this plainly. Strong economies do not come first. Rights do. But strong economies are an indicator when rights are upheld. When people have reproductive agency, when they can choose when and how to have children, societies are more stable, health systems function better, and economies are more resilient. Sexual and reproductive health and rights are not a social add-on. They are economic infrastructure. They are bedrock. Access to reproductive health care is foundational to girls' education, women's participation in the workforce, resilient health systems, and long-term social and economic security. It allows governments to plan rather than constantly react to crisis. When sexual and reproductive health and rights erode, everything else becomes harder and more expensive to sustain. National economies strain, institutions weaken, and trust in governments breaks down because people do not feel their governments working for them. At a time of growing geopolitical uncertainty and coordinated backlash against gender equality, Canada's investment plays a stabilizing role in the global system. They strengthen Canada's credibility as a reliable partner and reflect values like fairness, like dignity, like health and access to healthcare that Canadians overwhelmingly share. During the election, the Prime Minister committed not to cut international assistance. Protecting sexual and reproductive health and rights is one of the clearest, smartest ways to uphold that commitment and to demonstrate that Canada understands the moment it is in. Today, Action Canada for Sexual Health and Rights and our partners are calling on the government to publicly reaffirm and fully protect the 10-year commitment, including the $700 million annual investment in sexual and reproductive health and rights, and to ensure it remains a cornerstone of Canada's global leadership. Because leadership is not proven when it's easy. It is proven when holding the line is hardest, as we have heard in Davos recently. The numbers will show what works. The question now is whether Canada will continue to lead or step back at the very moment it has an opportunity to exercise outsized influence as a new global order is taking shape. Thank you.
Good morning, bienvenue. My name is Elizabeth Sully, and I'm the Director of International Research at the Guttmacher Institute, where we focus on producing rigorous research and evidence to advance sexual and reproductive health and rights worldwide. Today, we're sharing findings from our latest Just the Numbers Canada report that shows the impact of Canada's leadership in sexual and reproductive health and rights and family planning specifically. It also shows what is at stake with proposed budget cuts and why protecting Canada's investments in sexual and reproductive health and rights matters now more than ever. Before I begin, I just want to extend my thanks to Action Canada and the Future Planning Initiative for bringing us together and their leadership on this critical issue. Investments in sexual and reproductive health and rights have profound and measurable benefits. Such investments not only promote health and well-being throughout people's lives, but they lead to improvements in education, in gender equity, political stability, economic development, and environmental sustainability. Canada has made bold commitments to sexual and reproductive health and rights through the 10-year commitment. Family planning makes up an important part of Canada's commitment to comprehensive sexual and reproductive health and rights. And we have seen tremendous increases in Canada's investments in expanding people's access to contraceptive care since the 10-year commitment was made. Family planning funding increased from $42.6 million before the 10-year commitment to $76.2 million for the 2023 to 2024 fiscal year. And that is a conservative estimate of Canada's funding going to family planning, with other methodologies estimating almost twice that amount. And this funding is more critical today than it has ever been before. The government's proposed budget cuts put this progress at risk, and the timing could not be worse. The United States used to provide 40% of all global donor funding for family planning, but all of that funding has been withheld as of last year. The next two largest donors, the United Kingdom and the Netherlands, have recently cut their aid budgets and funding for sexual and reproductive health and rights. That puts 70% of all donor funding globally at risk or gone. Canada provides 7% of that donor funding, and it is needed now more than ever. At the Guttmacher Institute, we have a long history of measuring the impact of family planning foreign assistance in low and middle income countries. For over a decade, we have been annually tracking the impact of U.S. foreign assistance for family planning. More recently, we've produced 2 prior reports on Canada's investments, as well as reports on the potential impacts of cuts in the UK and the Netherlands. Let me turn now to sharing what we found in our most recent analysis of Canada's current funding for family planning and what is at stake if that funding is cut. In fiscal year 2023 to 2024, Canadian support for family planning was at least $76.2 million. This funding helped to provide 4.7 million women and couples with modern contraceptive care, preventing an estimated 1.6 million unintended pregnancies, including nearly 500,000 unsafe abortions prevented, and more than 2,100 maternal deaths averted. Behind those numbers are women who got to decide if and when to have children, young people who got to stay in school, and communities that are healthier and more economically secure because of those investments. Canada's leadership through the 10-year commitment has set a global standard for comprehensive, rights-based, and ring-fenced funding to provide predictability and sustainability over time. That predictability matters. Health systems cannot be built on short-term or uncertain funding, and we are in uncertain times. Canada's model recognized that long-term, reliable financing is essential for meaningful progress. It has not only saved lives, it has strengthened Canada's standing as a principled and reliable partner in global health and in human rights. But today, that leadership is at risk with any potential cuts to that funding. Proposed reductions of $2.7 billion to the development assistance budget threaten Canada's leadership in global health and in sexual and reproductive health and rights. For every $10 million potentially cut from the family planning budget, we estimate the impacts that will have on the real lives of women and girls around the world. That means that 623,000 people would lose access to contraceptive care. 213,000 additional unintended pregnancies would occur, 63,000 more unsafe abortions, and 277 more women would die from pregnancy-related causes. Funding cuts are not abstract budgetary decisions. They translate indirectly into closed clinics, supply shortages, overstretched providers, and people, especially women and adolescents, being denied essential care. Canada now faces a clear choice. It can sustain investments that are proven to save lives, to strengthen health systems, and to advance gender equality. Or it can pull back at a moment when global leadership is urgently needed. We are in a moment when funding is unstable and policies are being pursued by other countries that directly seek to undermine health and rights, including the United States' most recent harmful expansion of the global gag rule policy. Canada's leadership provides essential stability for health systems and communities around the world and helps to protect these essential rights that are being threatened. We are at a consequential moment. The challenges are real, but so is the evidence. We know what works, and we know what happens when leadership falters. The consequences are swift and severe for those with the least power and the fewest resources. We urge decision makers to protect Canada's investments in sexual and reproductive health and rights, to prevent backsliding on hard-won gains, and to ensure that bodily autonomy and access to care are at the heart of global development. Thank you.
Good morning. My name is Caitlin Goggin. I am with the Canadian Partnership for Women and Children's Health, CanWatch. I want to thank the Guttmacher Institute for its leadership on Just the Numbers, developed in collaboration with the Future Planning Initiative, with special thanks to Action Canada for its role in bringing this collaboration together. At CanWatch, we work with more than 110 Canadian organizations delivering global health and gender equality programs around the world. From that vantage point, Just the Numbers tells a story many partners already know, but that often goes unsaid. Canada's impact on sexual and reproductive health and rights is strongest when it invests in the areas that are most neglected, most contested, and most vulnerable to political rollback. These are not easy places to lead, but they are places where principled leadership has the greatest consequence. Canada's record on SRHR has never been built on safe or convenient choices. It has been built through deliberate investments in safe abortion care, comprehensive contraception, adolescent sexual reproductive health, including comprehensive sexuality education, and in advocacy that protects these services when they come under attack. These areas remain underfunded globally, not because they are ineffective, but because they are seen often and frequently positioned as discretionary rather than fundamental investments. Just the Numbers underscores the fragility of progress. Gains in contraceptive access, reductions in unsafe abortion, and declines in maternal mortality do not sustain themselves. They depend on predictable financing and explicit, unwavering political backing. When that backing weakens, progress does not pause. It declines, along with the well-being of women around the world. That is why Canada's approach to date has carried real weight. Through the 10-year commitment on global health and rights, Canada made a conscious policy choice to lead where impact is hardest to secure and easiest to lose. The results in this report are not accidental. They are the product of long-term integrated investments delivered predictably and at scale, and with at least half of the investment dedicated to sexual reproductive health and rights. Expert advocacy is a critical part of that design. Advocacy seeks to ensure services remain accessible, counters misinformation, and assists partners to navigate hostile policy environments. Yet, it is often the first cut when budgets tighten. Similarly, adolescents are too often treated as an afterthought. Adolescent girls, in particular, face some of the steepest barriers to information and care. Investing early is not only rights-based, it is smart policy. All of this is unfolding in the global context that is becoming more volatile, not less. The expansion of the Mexico City policy by the current U.S. administration is a stark example. It undermines access to care, silences organizations, and forces impossible trade-offs, with particularly severe consequences for women, girls, and LGBTQI+ communities where rights are already under sustained attack. That context makes Canada's choices even more critical. Budget 2025 exposed planned reductions in global health programming, justified as a return to pre-COVID spending levels. But what is often overlooked is that the 10-year commitment was announced in 2019, before the pandemic, and deliberately designed within a pre-pandemic fiscal framework. It commits $1.4 billion per year through 2030, with at least $700 million annually protected for sexual reproductive health and rights, deliberately prioritizing areas that are most neglected globally. These investments are not an outlier. They are a strategic choice grounded in evidence, expertise, and impact, and at the same time signaled Canada's staunch commitment to women and girls around the world through rights-based service provision. Just the numbers leaves little room for ambiguity. Canada should fully protect the 10-year commitment as designed, remain steadfast to our partners navigating an increasingly hostile global environment, and ensure that evidence and courage, not political convenience, continues to guide Canada's global health leadership. Thank you.
Good morning. I'm Shannon Fleming, the Director of Development and Communications with the Stephen Lewis Foundation. Canada's leadership on sexual and reproductive health and rights matters because comprehensive SRHR saves lives and because partial approaches leave people behind. At the Stephen Lewis Foundation, we support 98 community-led organizations across 14 African countries responding to the HIV epidemic. These organizations are deeply rooted in their communities, and they see every day that SRHR and HIV are inseparable. Our partners tell us clearly, comprehensive SRHR services are essential to preventing new HIV transmissions. They are also critical to the health and dignity of people living with HIV, supporting informed choices around pregnancy, birth, and breastfeeding, and access to care without stigma. Just as importantly, community-led HIV programs are often the most effective entry point for a full range of SRHR services, STI testing and treatment, cervical cancer screening, antenatal care, and family planning. When SRHR is comprehensive and community-led, it works. This is especially true for LGBTIQ+ communities. Among our partners are 14 organizations led by and for LGBTQI+ people, working at the intersection of SRHR, HIV, and human rights. Their work makes clear that inclusion is not optional. It is a core measure of whether SRHR commitments are real. LGBTIQ+ communities are disproportionately impacted by HIV. At the same time, lesbian, bisexual, and queer women, as well as trans men, are routinely overlooked or actively excluded from mainstream SRHR programs. A truly comprehensive SRHR program and approach must ensure that all people can access services that are safe, affirming, and designed for them. Alongside our colleagues at Action Canada for Sexual Health and Rights, the Guttmacher Institute, and CanWatch, we are calling on the Government of Canada to publicly reaffirm and fully protect the 10-year commitment, especially the $700 million in annual SRHR investments, and to ensure that these funds remain a cornerstone of Canada's global leadership. At a moment when the United States is expanding the global gag rule and directly targeting LGBTQI+ communities, Canada's leadership is not symbolic. It is life-saving. Continuing to lead on comprehensive SRHR is how Canada can uphold health, dignity, and human rights worldwide. Thank you.
Thank you, everyone, for being with us to talk about this important report. I know that we are at a time when a lot of us may wonder why this matters, when a lot of us in Canada are having trouble affording rent, paying for groceries. We're all moms talking about how we're going to afford the education for our children that we want them to have. And the thing is, what happens there matters here. And this is the important link that people need to make when we're talking about this important work happening in the world and the leadership that Canada can play. When we are talking about a world where brutal force is used to impose the will of some countries on others, when people are increasingly feeling unstable, desperate, and instability rises across the world, this kind of work to stabilize countries, economies, populations, and ensure that people have what they need to take care of their children, their families, and realize their rights. It matters here. It matters for the world in which Canada exists. It matters for the world that our children will live in. Thank you so much for today.
All right, I have a question online. Mr. Dylan Robertson from the Canadian Press. The floor is yours.
Hi there. Thanks so much for taking our questions. I'm wondering if I could just get you to clarify whether we've seen cuts on SRHR. I think that you touched on this, but I'm just trying to clarify it in my mind because what I hear is that what we're concerned about are looming cuts, but it seems as of now the Canadian funding that's been outlined so far, that's actually been followed through with on things like Muskoka Initiative. The real concern here is, very little has been allocated going forward, I guess.
Does anyone want to take this? Okay. Thank you for your question. We are working with the numbers that have been shared during the federal budget. We are also in conversations with our counterparts and colleagues in government and understanding that decisions are being made in terms of how the government will move forward with cuts that have been announced to programs generally speaking, but not necessarily any details on which programs will move forward and which will be prioritized. And in the budget, there were mentions that Canada had compared to other countries made outsized investments when in fact they are the kind of investments that ensure that Canada plays a leadership role in this particular sphere, which is, as it was exemplified by what was shared today by partners and by the numbers that we see in this report, particularly important, will increase Canada's impact in the world. It can increase our impact on systems that are important for a world that is stable and resilient in the face of instability. Thank you.
Dylan, do you have a follow-up?
Yeah, I'm just wondering what advice you might give to a parliament that seems to be proceeding with a cut on global health. The overall global health cut is called for in the budget. It seems like the government is going to proceed with that. I'm just wondering if your message is we should prioritize SHRH over other sectors, or if the cut should be consistent to reproductive health along with other global health sectors. I realize you don't want to see a cut, period, but a cut is moving forward. So, what is your advice to Parliament?
Yeah, absolutely. Go ahead.
Thanks, Dylan. We're just sharing the question load here. I think what I would say is that I think, as you've mentioned, the Muskoka initiative is exactly an example of where Canada has been able to have a unique value offering globally with its funding. These are services particularly around comprehensive sexual reproductive health and rights, which not all countries do fund, as we've outlined, and as is really very apparent in the world today. So I think our request and our recommendation to parliamentarians and to our technocrats is that they think very carefully about where value can be best placed with the funds that are available, and think about Canada's legacy to date in terms of being a leader on SRHR, reproductive health and rights, particularly access to safe abortion.
I have no questions in the room, so Dylan, if you don't have any other questions, I'll wait for you to raise your hand if you have.
Yeah, I just wanted to ask also about any sort of coalition building that we might see. I mean, the Prime Minister's Davos speech talked a lot about standing up with like-minded countries. I guess I'm just wondering if you see any room here for Canada to mount an effort. I mean, we're cutting back on aid. You already mentioned, you know, the Netherlands and other countries that are cutting back. But still, I guess I'm just wondering if your organizations have been looking at all at building that sort of partnership, or if the focus right now really needs to be on what is Canada doing.
I think we are at a moment that strength is in numbers in the face of increased instability, increased fear, increased brutal force being imposed on the world and on many countries. So cooperation between organizations, between countries, between civil societies everywhere is of the utmost importance. This is something that we are all focused on. So not just focusing on what Canada can do. And I think there's something important in terms of the leadership that Canada can play is that, yes, we are in a world where we are competing for resources. We are seeking to rebuild economic agreements, but to take simply an economic and a trades approach to this problem actually reinforces the transactional nature of what is happening in terms of the destabilization of the world by countries who are simply focused on amassing power and using brutal force instead of nourishing cooperation, diplomacy, and increasing stability across the world through cooperation. And so this is important to say. Canada and many countries in the world, all countries in the world, are facing very serious problems, very serious challenges, and are having to find their footing. And it's important to reaffirm the importance of rights and the importance of people and their lived reality as the first and foremost, first principle of our response and our cooperation and how we come together. And economics, strong economies, national infrastructure that is stable is actually an indicator that rights are being upheld. And so this is all, it's in our interest, everyone's interest, all the countries that want to come together to counterforce what is happening in terms of the dismantling of the spaces where countries have come together to work to make the world better. It is important that we come together with this lens of rights, of people's lived reality, of their everyday life, of what makes their lives better, their ability to take care of their children, of their own self, and people's dignity as one of the most important principle to organize around. Thank you.
And if I could just ask one last question, you know, we had the Prime Minister say that we don't have a feminist foreign policy, but that these are the sort of values that undergird our foreign policy. I guess I'm just wondering how that relates to the call you're making today. You know, is this sort of the clarity that you're seeking is where are we actually going to put our money here, given the context that you outlined at the start of this press conference?
I mean, absolutely. I think I can speak on behalf of this group that we would certainly continue to advocate for the Canadian government to speak declaratively and clearly that we have a feminist international assistance policy. And we very much believe that language does matter. And so we would encourage the government to continue to stand strong with its feminist international assistance policy. Speaking of coalitions around the world and where Canada is recognized, our peers, Scandinavian countries, members of the European Union, see our FEOP as an example that has been set and one that others have been aspirationally trying to follow. At the same time, Dylan, I think you've answered your own question in some ways. As feminists, we absolutely believe that SRHR, sexual reproductive health and rights funding, has to be maintained and should be the core of Canada's footprint in the international development community. Thank you.
All right, this will conclude our press conference. Ceci mettra fin à la conférence de presse. Merci beaucoup. Thank you very much.
Merci.
Thank you.